And then those are shaped by someone's vulnerability. So that could be demographic, socioeconomic, their gender, et cetera. And then also their exposure to these different risks because of where they work, where they live, et cetera. One last thing I'd like to highlight on here is that at the bottom, we see all these different health outcomes, which again, we'll touch a little bit on tonight. But on the far right, we also see that health systems and facilities are included in all of this. And I'm hoping that in our panel discussion, we can touch on this a little more. But we know that the healthcare system, these institutions are also kind of bound up in all of this and have a responsibility as our climate changes. So Lee, if you go to the next slide, please. So the first section we're going to talk about is transportation. If we'll go to the next slide. So as some of you might know, transportation in the United States is the leading cause of greenhouse gas emissions. This is also true in Virginia, including in Charlottesville, Albemarle County, and Richmond. And greenhouse gas emissions from traffic, as well as tailpipe emissions, are associated with a variety of health effects, including respiratory, neurological issues, as well as they can even increase one's chance of premature death. And um, as you can see, there's noise emissions, traffic related injuries, et cetera. And if you'll go to the next slide, Leah, we know that there are certain burdens that communities face because of pollution. So we know that low income and BIPOC communities are more likely to be near high traffic corridors, near highways, and have higher rates of exposure to these pollutants. So this graph's pretty stark. It shows us exposure to PM 2.5, particulate matter 2.5, which is directly associated with automobile emissions. And as you can see on the left side of this graph, racialized groups such as African Americans, Asian Americans, and Latinos are disproportionately exposed to this compared to their white counterparts who are on the very far right side of this graph and who actually have below average exposure. And if we'll go to the next slide. So I think that this is an opportunity for different solutions. And part of this webinar is about thinking through certain recommendations or steps that we can take. And so something that C3 often advocates for is multimodal transportation, which means that we are centering transportation that is varied and accessible. So that would include being able to have bike and pedestrian friendly infrastructure so people can walk, bike, scooter, wherever they need to go, but also investing in public transit. And then of course, having cars. For us, when it comes to, uh, buses and cars, the greener, the cleaner, the better. But one of the reasons that multimodal transit is really important is that it is inherently accessible. So some folks are not physically able to walk or bike to their office, for example. Others are not able to pay for and own a car, right? So pushing multimodal transportation means that we're creating a much more accessible community for everybody, but we also know that this has more positive health impacts on folks. If we're expanding bike and ped-friendly infrastructure, if we're investing in our public transit and really prioritizing that, that means less vehicles on the road, which means less air pollutants, emissions, and injuries overall. And so it's really kind of a holistic approach to addressing emissions in the transit sector. Leah, if you go to the next slide, please. And of course, there's electric vehicles. I think there's a lot of work still to do in this sector in terms of making it accessible to all sorts of folks. But we know that EVs, especially as they get cheaper in the future, not only have zero, tailpipe emissions, but they also will have a significant impact on injury and illness that's related to driving passenger vehicles. Leah, if you'll go to the next slide, please. So the next section of this webinar is going to focus on land use and zoning. And I think that this is a topic area that sometimes isn't as included in conversations about climate and health. Um, but the reason why we're including it is really because where you live, literally where you live or work, does have a relationship to your exposure to climate impacts and also your vulnerability to certain health outcomes. And that's something we really want to highlight. So if you'll go to the next slide, Leah, we want to start by talking about location efficiency. So location efficiency refers to kind of your degree of proximity to kind of essential services, goods, etc. So, for example, hospitals, schools, grocery stores, etc. And if you live in an area with low location efficiency, that most likely means that you're going to have to rely on a car. These areas are usually less accessible by public transit, might not have the infrastructure to promote walking or biking, and they can reproduce a lot of inequalities. So this map on the right is actually measuring low income households and food access in Richmond. So this is measuring for low income households how close they are to a full service grocery store. And when we say full service, we don't mean like a mini mart on the corner. We mean a full service grocery store like a Kroger. And so in the orange, we see low income folks who are at least half a mile away from a full service grocery store. And in green, we see folks who are low income and at least a mile away from a full service grocery store. This is really important, I think, to highlight because we want to really try to frame this around a holistic idea of health. So not only are we talking about, folks not being exposed to, pollutants from cars, for example, but also people having access to things like healthy and nutritious food. Where you live can really impact this. And that's what we really want to highlight. Leah, if you'll go to the next slide. So in turn, we also want to touch on displacement, extreme weather, et cetera. And so, kind of building on what we just said, we know historically marginalized groups are more likely to live in areas that have what we might call undesirable environmental conditions. So, that a great example of that is kind of disproportionate exposure to heat or extreme heat. As you can see in this image on the right, in Richmond, white households on average are exposed to lower temperatures in the afternoon than Black households. Um, and so not only are historically marginalized groups living in areas that might have worse environmental conditions, but this also means that they're more likely to be displaced because of climate. So for example, if you live in a community that is really at risk for flooding, there's a higher chance you're probably going to be displaced by a flooding event. And in turn, some of these communities actually have a higher risk of being pushed into other areas that are at risk for climate related events. So as you can see, a lot of it kind of feeds itself. Vulnerabilities are kind of reproduced throughout all of this. And so all of this comes together kind of with this next slide, if you'll go to it, Leah, which is really emphasizing the role that discrimination has played in how we zone and plan our cities. So all of what I've just talked about is symptomatic of kind of centuries long policies, including here in Virginia and Charlottesville, in which certain neighborhoods are greener, are cleaner, than others. And so we know that redlining policies and Jim Crow policies in American history created neighborhoods that were more susceptible to extreme heat. So specifically Black neighborhoods, including in Charlottesville, are less likely to have tree canopy cover. They're more likely to have asphalt and cement, which of course are very hot in the summer. And this is because, of course, of centuries long underinvestment in these neighborhoods, very little political power that these communities had to advocate for green spaces and for planning that was more kind of proactive to climate, to heat, et cetera. And I really want to highlight on this slide, as you can see, that Black folks in particular are some of the most vulnerable to climate change in our country. They're 40% more likely to live in areas that will experience the largest increase in extreme heat deaths. And they're also at the most at risk for flooding. As you can see in this map on the right, I'm from Texas originally, and so I'm very familiar with Texas and the Gulf Coast. We know that there are a lot of Black and Brown folks who live in these communities on the Gulf. They're tied to these places. They love them, but they are also extremely at risk when it comes to flooding and other kind of related climate issues. If you want to go to the next slide, Leah. But I also think that this is a really great opportunity to talk about how we might improve this. And Charlottesville is a great example. As some of you might know, Charlottesville has historically had pretty low density zoning regulations, but in recent years has been changing this and is actually currently rewriting their zoning with an emphasis on increasing the amount of high density zoning in the city and affordable housing, which is another issue the city continues to struggle with. And so we know that high density housing is not only going to, of course, increase the amount of housing in the city, which in turn increases the amount of affordable units for people to live in. But actually, high density housing has a significantly smaller environmental or carbon footprint than low density housing. And so we know that it reduces travel pollution by around 50%. It reduces residential energy use by a third. And again, that carbon footprint is about 4 times less um, than low density housing. And I think this is a little bit counter to maybe what some of us might think. We might think more people in one space automatically means bigger carbon footprint, but that's not necessarily true. And so again, something I want to emphasize with this is that, with zoning, for example, high density housing is equitable not only because it increases the availability of housing, but also because it actually creates a safer environment for everyone. So again, these things are really interconnected. I'd like to go to the next slide, Leah. So the next issue area we're going to talk about is energy, which is a field that C3 has engaged with a lot. Leah, if you'll go to the next slide. So natural gas is a key issue area for us. And as some of you might know, natural gas in homes has been linked to a variety of respiratory issues and related health effects. And a key thing with natural gas is it is a fossil fuel, but it's also made up of methane, which has 25 times more warming potential than CO2. And so this is again a moment where we want to kind of push certain recommendations for folks for natural gas in the home specifically. So you can turn on your fan when you use a gas stove. You can learn about signs of a gas leak. And you can also ultimately invest in electric appliances. Um, but as you might already know, investing in electric appliances is not always cheap. And we want to touch on that in a second. If you'll go to the next slide, Leah. But first, we want to just mention energy efficiency. So energy efficiency is important in homes and buildings, not only because it lowers energy demand and the need to build new energy generation, which lessens emissions, but also because it has direct impacts on our health. So by installing, ventilation systems and improving building efficiency, you actually reduce indoor air pollutants and mold, which have been linked to various respiratory issues, to allergies, etc. And then by installing things such as proper insulation or weatherizing your home, again, as the climate changes, as we experience more extreme temperatures, this is a way that we can protect folks from extreme temperatures and their various effects, while also prioritizing the most vulnerable, right? For example, elderly folks might be more sensitive than others to the heat or cold. And so again, investing in this kind of at every level, make sure that they're protected and prioritized in all of this. Leah, if you'll go to the next slide, please. And so in all of this, we really want to center energy equity. So as I mentioned, some folks, electrifying your appliances is great, but not all folks can afford to do that. And we know that this is and we know that there are certain groups that are less likely to be able to afford that. So low income folks and BIPOC are more likely to have a higher energy burden. Energy burden refers to how much of your monthly income goes towards energy bills. And we know that they're more likely to have higher energy bills in general. And so they're not able to afford to switch to more energy efficient appliances, which again puts them at a higher health risk. Uh, and then we also know if you have, for example, a really high energy bill, and you also live somewhere that has pretty high rental prices, a lot of your money is going towards just kind of basic necessities such as rent and, having the lights on, right? And if a lot of your monthly paycheck is going towards that, that means that folks are less likely to have money to spend on other things, and would be trapped or more likely to be caught in cycles of poverty or low income, and not really be able to break from that. And so when we talk about energy equity, we have to recognize that it's really tied up with housing equity, with transit equity, et cetera, because, all of this affects each other and what people have money to spend on, et cetera. And if we're also situating this in a conversation about health, if we know that these things can also adversely affect someone's health, that's more bills people are paying, right? It's not sometimes cheap to go to the doctor. So again, this is all kind of connected. Um, if you'll go to the next slide, Leah. So the last kind of section that we're going to touch on today is mental health. I think as a young person coming into the climate space, I've seen this become more prominent in conversations, but I think there's still a long way to go. And if you'll go to the next slide, Leah. So I think most of us can relate to probably having some degree of what we might term climate anxiety. So these are kind of negative feelings, maybe uncertainty or fear or doom even about the future of our planet and our families, our communities because of how enormous climate change feels. We know that this impacts the majority of Americans. And we also know that that's kind of just on a general, basic level. But for folks who are actually experiencing kind of climate related events or disasters, such as a wildfire or heavy flood, that can also cause a lot of really long-term mental health effects on these folks. Again, we never want to generalize how an experience shapes someone's mental health, but we know that there is a higher chance of developing, for instance, something such as PTSD. And so all of this can take a massive strain on someone's mental health. And I think that mental health is arguably as important as physical health. And so figuring out ways that we can tackle this is essential as our climate continues to warm and change. Leah, if you'll go to the next slide. And so these are just a couple of solutions or recommendations that we might center in our conversations. And so I think something we really wanted to emphasize was building kind of a social support network around you. This is not an individual struggle, it's collective. And so I think I could speak from my experience, not only through my work, but those around me, being surrounded by folks who are concerned and can provide comfort is essential. Um, but also taking action. I think, taking action within your community, such as joining a local org or advocating for better emergency planning and preparedness, not only I think can, of course, benefit your entire community, but hopefully provide some type of comfort or reassurance to yourself. Um, of course, being at C3, we advocate for a lot of change in our community when it comes to climate issues, and we really try to encourage others to do the same. Leah, if you'll go to the next slide. It's something I also want to touch on here is that we know that certain groups are disproportionately affected by this, and that mental health impacts might not even really be the right language to actually describe what they are experiencing. And so I think Indigenous folks in particular are a group that we really want to highlight. So, Indigenous folks in the United States have generational trauma because of colonialism, land theft, displacement, and disproportionate exposure to climate change. And a lot of people are tied to place, right? And so if you are tied to place and that place is disrupted or destroyed because of climate change, that has multi-generational ramifications for people. Climate change affects people on on a lot of different levels. And I think, again, emphasizing that health is holistic, and it not only includes your physical well-being, but your mental well-being, your spiritual well-being, your communal well-being, et cetera. And so for groups that are really tied to place, I'm going to have very traumatic relationships with place. I think we need to pay special attention to that. We know that historically marginalized communities are disproportionately displaced, and we also know that they disproportionately carry these burdens of climate change. And so I don't think there is a kind of quick solution here, right? There's not going to be a solution slide for this, but it's something that I just wanted to foreground in our discussions about this and perhaps kind of point us in a more transformational direction um, as we are kind of sitting with all of this. And so, Leah, if you'll go to our final slide. So this is just kind of a little bit of a summary. So we know that climate solutions equal health solutions. They are not separate, but rather deeply intertwined. We know that climate change is harming human health on multiple levels. We know that racism and discrimination exacerbate these impacts and cause disproportionate impacts. And so, what we ultimately need, and this is not an exhaustive list at all, but are adaptation and mitigation actions that are timely, effective, and also culturally appropriate. And I really like including culturally appropriate here because, again, if we recognize that our work needs to be local and contextual, that also means really deeply engaging with folks about what is useful to them and allowing them to also lead a lot of these initiatives. And then that kind of follows to our next point, which is local and community-led involvement in decision-making processes relating to climate change. Again, C3 really centers this in a lot of what we do. And we really encourage anyone listening, anyone interested in doing work in this field to do the same. And so that's kind of where we're going to leave the presentation. But I hope that this was at least a little bit helpful and maybe you learned a couple of things. But we're going to now transition to our panel discussion. Leah, if you would go to the next slide, please. So I wanted to take some time to allow each of the panelists to introduce themselves in their own words. And so if y'all wouldn't mind just kind of introducing yourselves, give us your pronouns, please, and then just, you know, an introduction to what you do and perhaps your relationship to climate and health, just on a kind of basic level. Venkat, if you want to start, that'd be great.
Yeah, absolutely. So my name is Venkat. My pronouns are he and him. And I'm currently a fourth year medical student at the University of Virginia. And I'm part of a student group at the school called Student Clinicians and CIimate Action. I've been there since my first year. And through that group, I got to work with C3. And so that's how I'm here right now.
Wonderful, thank you. Greg, if you'd like to speak.
Yes, my name is Greg Winston. I'm a retired healthcare executive who now works in the volunteer space, looking at health access and issues associated with inequality. Currently, I serve as the co-chair of the Move to Health Equity Coalition, which is an organization that believes in the collective impact model, meaning that it takes up a handful of us to get things done. No one organization can do it alone. We look at the issues related to health equity from the lens of social determinants of health, which is kind of what you talked about earlier. There are multiple factors associated in health. It's just not direct care by a doctor, but it's the environment in which you live. I also serve as a board member of the Charlottesville Free Clinic, making sure that no one who needs care and doesn't have insurance goes without that care. And so as we look at making sure that folks have access to care is one of the primary things that I work on now.
Thank you. And Dr. Meyer? Oh, you're on mute.
No, I'm not on mute. I'm Matthew Meyer. I'm an anesthesiologist, ICU doctor at UVA. I co-founded a company trying to reduce waste in the operating room. And I'm a steering committee member of the Virginia Clinicians for CIimate Action. Sustainable healthcare, so making the health system work better, cleaner, more efficiently, and climate health. So issues like we're discussing here are a huge part of my portfolio. I do a lot of advocacy, writing, and talking on these issues, and I'm really thrilled to be part of this panel tonight.
Amazing. Thank y'all. And so I just want to say real quick for folks who are watching, at any point during the discussion, if you want to pop any questions in the chat, feel free, but we'll also have some time at the end for y'all to ask questions audibly directly to folks. So there's obviously a lot of things to cover here, but something that I kind of quickly noticed when we we're putting this panel together was that everybody who is here has some type of relationship to healthcare systems or the healthcare institutions themselves, whether as a student, a practitioner, an executive, et cetera. And so I was kind of curious, just starting us off kind of from that perspective. Um, as we kind of emphasized at the beginning, there is certainly a role for these institutions and systems to play as our climate changes. And I'm kind of curious from y'all's perspective and the work that you do or have done, what role you kind of see there or improvements that need to happen. And Dr. Meyer, I guess just starting with you, I know you mentioned that you, of course, do work with a medical waste company. And I would love to just start by hearing your perspective on all of that, and perhaps issues within these systems that we might not be aware of.
Sure. So my personal opinion, and one which I'll shout from the treetops, is that health systems, healthcare should be leading the climate conversation. Unfortunately, health systems are probably behind most industries, including the auto industry, which is always a little befuddling to me as to how we got so behind. I think we're catching up. The Department of Health and Human Services in the US has set up the Office for Climate Change and Health Equity, which is focusing on the issues that we're talking about today. So it's a small but mighty office, and it's trying to take on a lot of these issues that we're talking about. There's other health systems throughout the world that are probably doing this better. Specifically, in the last decade, the National Health System in England has been doing a wonderful job of drawing attention to the problems of climate change, as well as really modifying their health system to become more sustainable. They have, I want to say by 2040, they're planning on being net zero in their whole health system. Whereas you'll notice that the best that we're doing in the US is voluntary goals of reducing emissions by 50%. And those are voluntary goals, and there's no methodology for tracking. So that's just framing the issue. This is something I talk about for a long time, and I love it. I think it's interesting. I think the biggest issue that we're dealing with right now is standardization and data accessibility. It's really difficult to get the data you need to make smart decisions about health system sustainability. And then once you do get that data, you could be looking at good data, and another institution be looking at good data, and your data doesn't talk to each other. And so it's really hard to get that positive feedback cycle where you can start working with each other to make these problems start to seem smaller.
Greg, do you want to hop in and share your experience and your thoughts?
Yeah, I agree with Matthew. I think the healthcare system is beginning to come around and realize its role. Historically, it's been more focused on episodic acute care stuff that comes through the door, and as a money-making vehicle, what can they bill and collect for? There needs to be now a more expansive view of what that is, and how do you look at what we now call population health, which is for me a combination of acute care and public health. And how do we begin to look at and make sure that the people who are around us that we understand what those conditions are, and as Matthew says, getting data to really define what those issues are difficult. I can tell you that data from Centera and UVA, that make up the Charlottesville area, there's probably no one place you can go and get that data. But that data is needed for us to be able to understand the true depth and breadth and the scope of issues associated with the prevalence and incident rates of various diseases that we need to focus on. So tearing down barriers, but having a more expansive look at things, and having health institutions take on a community, civic, and social responsibility for the health status of its residents.
Yeah, no, thank you, Greg. Venkat, did you want to hop in and offer anything? I also wanted to kind of in that same vein also talk about, what not only healthcare institutions, but also kind of related educational institutions might kind of do in this regard. I know that you have done a lot of work with kind of reforming some of the education in kind of medical schools and institutions around climate change. And I'd love for you to speak on that a little bit, and then also just offer any thoughts following Dr. Meyer and Greg's remarks.
Yeah, absolutely. I think overall, I absolutely agree with what's been said about the broader healthcare system. I think speaking from the perspective of a student, I think there definitely is a bit of a lack in terms of exposure to how climate affects health, and also how we as the healthcare system affect the environment as well. And I think that's something that's been pushed for more within our school. So our organization, working with Dr. Meyer, has really pushed for more exposure to that, both in the sort of preclinical setting as well as throughout our clinical settings as well. And so we've been working on creating more learning objectives for like the preclinical section of medical school. And so I think that sort of exposure is becoming more and more prevalent. There's an organization called the Planetary Health Report Card that essentially is nationwide, and also in a lot of other countries as well, that basically measures how well the medical school basically teaches about how climate affects health. And so that's actually becoming more and more popular. And so there's been more of a nationwide push for more exposure. I think personally, it's really important because as climate change starts to speed up, and as our health starts to be affected more and more, as we've talked about, I think it's important to be able to talk about those things when you go to see a doctor. And it's important to teach your skills of how to solicit information involving how the environment has affected your health when you go see your primary care doctor or your emergency medicine doctor, things like that.
One of the other things that from just looking at the educational part of it, the medical institutions need to do a better job of increasing the diversity of the resources that they are producing. There's still a disproportionate number of doctors and nurses of color as relates to the population. We know that there are better outcomes when there is a concordance between the doctor and the patient, and so therefore increasing those numbers is important. Historically there were only two Black medical schools in the country up until the mid '60s. They added one in LA with Drew, and one in Atlanta with Morehouse. But still, when you look at minority physicians as a percent of the total, those numbers haven't moved a whole heck of a lot. So as a system, we need to look at and be able to address the diversity in the health manpower as well.
No, absolutely. And I really appreciate you bringing that thought to all of us, Greg. And I think it gets me thinking about, not only how, of course, it might allow medical institutions to build trust with folks if they're from those communities, a part of those communities, et cetera, but also even the knowledge or education that's being produced, within these institutions, how that might be biased in certain ways. And in that same vein, I was kind of thinking about, as we talked about a little bit, we know that where someone lives can have an impact on, health outcomes, what they might be vulnerable to, et cetera. And so I'm kind of curious from y'all's perspective, whether through it's, through your work or advocacy, how you kind of approach this or incorporate it into your work, and perhaps room for reform that you see there as well. So again, looking at vulnerabilities someone might face because of where they live, or kind of other related factors. Greg, do you want to start us off? I know that you do a lot of work in this field, and I'd love to hear your thoughts to start us.
Well, if you want to know what's the most predictive indicator of health status, is your zip code. And that tells you a lot more about what about your life expectancy, what kind of diseases you're going to have, and how do you begin to overcome the issues associated with that. And you talked a little bit about it during your presentation, the red line, and people living in areas where they are overexposed to negative environmental issues. The transportation system is such that it doesn't allow them to get to places to seek care. So all of those things have had a tremendous impact on what the health status of the community is. I've worked, and my definition and looking at this has improved as I have worked with C3 over the past years. My horizon and my vision in terms of how do you look at and improve health outcomes has gotten to a point that we now look at those things outside of just what the doctor and the institutions can do. Food, housing, transportation, all of those things play a major role and need to be accounted for as we do that. So as we begin to try to address the problem, we can't just have a one-prong approach to things. It has to be a multi-prong approach. It has to be a collaborative approach that involves everyone pointing towards a North Star.
Absolutely. Dr. Meyer, did you have any thoughts?
I think especially focusing on the interaction of climate with health, I think it's important for people to realize that this is an all of the above problem. This is an everyone problem. We are focusing on the fact that, there's populations throughout the world. Essentially, data shows everyone in the world is being affected by climate change. Whether you recognize it, appreciate it, believe in it, it's happening. There's people that can air condition their way out of it, that can move their way out of it, that live in just more comfortable spots, as you demonstrated with some of the maps from Richmond. But this is coming for us all, and so it's really important that we approach this as an us problem, and that this isn't something that we can let that's so far in the future that we can just sort of let others suffer, and then when it comes to us, we deal with it. We deal with it now, or else it's all going to be on our shoulders. And so that's one of the messages I try to talk to about people, is that we've got to extend, if we can't extend the empathy, we've got to at the very least be able to appreciate that it's coming in our future. But ideally, we're able to really look out for those who have the least among us, because poverty is a tremendous association with both health effects as well as impacts from climate. And I don't know. Someone put into focus for me a little while ago, which is because you always see the hurricanes coming, and you see some people are like, I'm just sticking it out, and you got to ask yourself, like, why is that person sticking out? And guess what? Like, if you do not have a car or you cannot pay for a hotel, you stick it out. You don't have a choice. You might put a face on like you got a choice. You don't have a choice. And so those are the people that are going to get hurt first by all of these issues. And so when I write, I try the best I can to use examples, to use empathy, to try to get people to really pay attention to the fact that this is us. This is our community that's going to be affected, and it's going to be very personal before you know it.
Yeah, I want to echo what Matthew just said. It's an all of us problem, but it affects different groups and different levels, and that the enlightened view is that we all need to work together, because at some day it's gonna get you. You may live on the basement. I mean, it's like, we're all on the same ship, and if the ship is sinking, those of us who are at the lower levels are going to die first. But if you're on the top level, it's going to get you sooner or later. So we all need to work collaboratively in order to address those things that are confronting all of us.
And to that note, I mean, and this is, I think, part of why I really appreciate this organization, is that community is so fundamental to almost all of these problems. I think that we've unfortunately lost a lot of our community in the past few decades, and I think that if we can work to build a lot of those, like, we can build that back up in whatever fashion. I think that solves a lot of the issues that we have with communication, with support for one another, and being able to have that empathy. If you know someone, it's a lot harder to just ignore them.
Oh, absolutely. And Venkat, before I move on to something else, I wanted to give you some space to offer any thoughts, even just in agreement, with what we've been talking about.
Yeah, absolutely. So we learned a lot about social determinants of health at school, and it's a very prevalent topic and very important as well. I don't think we necessarily talk about it in the realm of like climate and how the environment necessarily affects it, but I think that's something that needs to be touched upon more, because again, I think if clinicians can have a better understanding of how the environment affects health, they'll know to ask those questions. They'll know which of their patients may be more vulnerable and may need more tailored care with respect to that.
Yeah, absolutely. And I was thinking, and this will have to kind of be probably my last question before I offer up the floor to any folks who might want to ask. But, this has all kind of gotten me thinking about, the importance of community, of communication, of trust, et cetera. And I'm kind of curious from y'all's perspectives, because there's been, of course, a very deep politicization of health in our country in the past couple of years, and also very deep politicization of climate change in the last couple years in our country, and I definitely think they can feed each other, and might impact, our abilities, whether as advocates, as practitioners, et cetera, to kind of offer the best care or solutions. What is y'all's kind of perspective on that? How do you think about it or even approach it in the work you do, or even just issues that you feel like really we got to kind of sort through?
I can start. I think
Yeah.
in terms of like the politicization part, I think I remember hearing about how someone like described our healthcare system as a workshop, and not necessarily like it's really good at very acute care, very like care that's needed in the moment. But in terms of preventive care and long-term care, it's not really a very strong suit of the healthcare system in the US. And so I think that's something that it's difficult, I think, to fix, given how entrenched our healthcare system is currently. But I think that's a really important topic, something we kind of mentioned already a little bit, but I think that's a kind of important topic to think about with respect to this.
I mean, I think I would back it up to say that science has been politicized in the last decade or so, and it's just a shame. I mean, it's logic that's being politicized, and I have theories. What I do is I spend a lot of time finding common ground with people, and I do sit and talk, and I talk about this all the time. So sometimes I put my foot in it, sometimes someone really doesn't believe, but I'll tell you, when you get down to the essence of this, which is like, honestly, it's like caring for each other. It's having clean air and clean water and not having pollution everywhere. Like, people agree on these basic building blocks. It's just, you've got buzzwords that have really been, used as political cudgels. And I spend a lot of time trying to figure out the right language and the right ways to communicate my message. And one of my strongest messages is that, this isn't going to be a top priority for everybody. There's some people who are for whatever it is, they are not able to see this far in the future. Maybe it's because they're worried about the safety at home or the food on their table. And I don't blame them. Like, I can only imagine what would be going on in my mind if I didn't have those bases covered. But, giving people a little grace and listening and learning the language is what I take to try to get past this sort of ridiculous over politicization.
My thoughts on this, and I've come to this over the course of my 50-year career, is that I've always believed that healthcare is a right, that it's like education or anything else, and that everyone should be entitled to it. And the parsing out and figuring out the haves and the have-nots and who gets what, and two standards of care and two tiers of care are part and parcel of the systems that need to be dismantled to look at, just like, fire, police, health should be in that same vein. We all need to have access to good health care, and it should not be denied us just on an economic basis. And lately, it's gotten to a point that folks want to take away rights and privileges that have been granted and afforded to us that have demonstrated to be a positive benefit. And it's difficult to have those kinds of conversations now in terms of, what does the social contract actually call for? What kinds of things do we need to do one for the other in order to make sure that we can mutually exist in an environment that affords us, clean air, clean water, healthy foods, and a good place to live. And those should not be things that we need to have discussions about, but they are things that are clearly the dividing line now. And hopefully calmer heads can prevail, and we can find common ground that allows us to begin to have those discussions and to make meaningful business decisions. We all know that it's an ounce of prevention is worth a pound of cure. That if we do the right kinds of things and providing primary care and those kinds of things, we will obviate the need for all of the ultra excessive acute care services that we might need down the road that will lead to better quality of life, longer life expectancy as well.
No, absolutely. And thank you all for responding to that so thoughtfully. So we are coming towards the end of our webinar. But I did just want to give an opportunity maybe for one question from the audience, if anybody has anything that they'd like to ask our panelists. Please just raise your hand now. And you can ask a quick question. Anybody have a question? It's okay if not. Okay, no worries. I'm sure everybody's excited to eat some dinner. That's totally fine. But if you do have any questions or responses to the webinar, please just email us at C3 and we'd be happy to answer them. And we'll just wrap it up here. And I just want to thank everyone who came and joined us tonight. I want to thank our three panelists for spending time with us and offering their insight. And we will post a recording of this online sometime soon. And you will all be able to access that. We'll send it to everybody. But thank you all again. And everybody, please have a good night. Stay safe. Thank you.
Thank you all for being here. Thank you, C3, for inviting me.
Thank you so much.
Yes, Maria. Thanks for including me on this conversation as well.
Of course.
Sorry, I'm trying to end the recording.
You're good. I think that maybe